Today, our topic is structural inequality in healthcare sector during COVID times. Right from the time COVID-19 had entered our country, a sector that was in spotlight was healthcare. Many suffered out of COVID-19, but thanks to the doctors and hospitals, many were able to come out of it. Not everyone. The coronavirus originated from other countries, which was carried to India by the immigrants from other countries. New Delhi was hit at the start of April, with the worst coming near at the end of the month. The southern city of Bangalore was hit about 2 weeks later. The surge is at its peak, known in many small towns and just reaching others during that time. COVID-19 has centralized the need to address the toxic combination of poor social policies, unfair economics, and bad politics, which are responsible for much of health inequity. Countering this requires building solidarity to realize health for all. Since the Commission on Social Determinants for Health report criticism of the unequal distribution of resources, power, and money has intensified. A case in Mumbai shows that while many stayed in quarantine centers, few escaped from it by bribing the necessary government officials. This carelessness leads to such a big pandemic from which we are still suffered to come out of. The migrants who were working for a low salary were terminated from their employment and no proper transport was given to them in order to make them reach their hometown, because of which they had to walk back to their hometown. The workers had faced enormous hardship and outright discrimination, leading to their added physical and mental distress, pain, suffering, and death. Most of these victims have belonged to the economically distressed low social classes of the Indian caste hierarchy.
The COVID 19 pandemic has reproduced the same discriminatory practice related to caste, in which the media gives us an account of oppressive caste to community people. And also, the minority community members refuse to eat the food cooked and served by Dalit women at quarantine centers. Dalits have proved to be especially vulnerable to the disease for a range of reasons. Chief among them is poverty. The vast majority of Dalits are poor despite a vast affirmative action programs that India put in place shortly after independence. According to CNN, sanitation workers clean hospitals for 7 to 8 hours a day, but many say that they're not given a sufficient protective gear. They say that they have been given only a single layered cloth mask to protect themselves from the virus while at work. It's clearly visible that the graded inequality among FC, OBC, and SCs persists in housing characteristics, availability, and accessibility to the basic amenities. For a person to be in home quarantine, it's essential to allocate a separate room with adequate ventilation. But it's unfortunate because almost 40% of the Dalit households have only one room, while around 30% of them have more than 5 members in that single living room. When the pandemic exploded here in early April of 2021, the Dalits found themselves struggling to keep at least one relative alive as the medical system neared collapse and the government of India was left unprepared. In some places, hospital run by some Hindu communities treated its patients on the basis of their caste and not on the basis of their emergency. The high caste people were allowed to use the bed, and the lower caste people were treated on the grounds or on the floors of the hospital. Even though the doctors were working all day and night in hospitals, beds were being available for rich and so called privileged people by some political influence.
On the basis of economic structure, while ultra rich Indians have successfully managed to distance themselves from the growing health crisis, a majority of the population, even middle and upper middle income families, have been forced to deal with the COVID 19 crisis with limited resources. The rich and well connected still have money and contacts to smooth the search for ICU beds and oxygen tanks. But rich and poor alike have been left gasping for breath outside overflowing hospitals. The shortage of oxygen and beds across India is being made worse by wealthy and well connected Indians being admitted to the hospitals unnecessarily, according to the World Health Organization. Indian High Court judges have also commanded 100 five-star hotel rooms to be used as an exclusive COVID 19 health facility for them and their families in Delhi, despite many Indians dying outside at capacity hospitals and in their homes. We can also see that the rich and higher middle class people could afford the treatment and the medicine for the virus, and others suffered from not getting enough beds to get treated during the second wave. They were being treated in ambulances and on the roadside and were not able to get proper oxygen at the right time. As we know, the medicine for the virus was very scarce during the second wave, and only the rich could afford it. And the poor and the people who were financially weak couldn't buy it at the right time. Because of which, some had to deal with their loved ones being zippered into body bags. The desperation comes in waves, but when a pandemic wave hits, everyone is on their own, the poor and the rich, the well-connected bureaucrats who hold immense sway here, and the people who clean the sewers. Wealthy businessmen fight for hospital beds, and powerful government officials send tweets begging for oxygen. Middle-class families scrounge wood for funeral pyres where there's no wood. Families have dumped their relative bodies into the Ganges River. Hundreds of bloated corpses have been found. Currently, part of the problem is that many people rush to the hospital also because they do not have access to information or advice. There were also claims on social media of Indian politicians occupying hospital beds despite not suffering from severe symptoms. In Delhi, a decision to reserve 100 rooms for the judiciary at Delhi's Ashoka Hotel, where they would be tended by staff from a private hospital, caused further anger. The massive wealth gap in India has been left exposed by the second wave of COVID 19, as poor Indians struggle to access basic healthcare facilities during the second COVID 19 wave. Wealthy families are reportedly fleeing the country. When the COVID 19 pandemic initially hit India, it resulted in acute financial distress among the poorest families, while top billionaires became richer by 35%, according to non-profit rights group Oxfam.
Challenges for India's poor during COVID. Financial capacity to afford critical drugs. Yes, in fact, a fraction of India's population have been able to get proper treatment during the rising second COVID 19 wave, while thousands of families are struggling, running pillar to post to even secure a hospital bed for their loved ones. India's weak public healthcare system. Even those who have financial capacity to afford critical drugs, oxygen, and hospital beds have struggled during COVID 19 crisis in India. Many families were left with no choice but to desperately reach out for help on social media. Thirdly, lack of official government channel to provide support during emergency. So, what makes this impact of the second wave on the poor worse is the lack of official government channels to provide support during this emergency, be it hospitalization or procurement of critical drugs and oxygen. Fourth, poorer families facing lack of healthcare benefits. Another hurdle the poorer families are facing is lack of healthcare benefits. Most salaried class individuals have access to health insurance, but those working in the informal or gig economy have no such benefits. Fifth, families do not have financial resources to approach private hospitals for treatment. Yes, without facilities such as health insurance, the poorer families do not have financial resources to approach private hospitals for treatment. Their only hope is to get treated at government-run hospitals, which have been totally overburdened during the second wave due to lack of adequate infrastructure. People living in the villages who are really good financially don't have the awareness of vaccination though it has been repeatedly said by the government to vaccinate. Thank you.